begin with the first topic is hematopoiesis. Hematopoiesis in embryonic or fetal life, it occurs in yolk sac. Then after in adult stage it occurs in bones. Up to 20 years it occurs in long bones. After 20 years it occurs in flat bones like sternum vertebrae. Then hairy skin receptors. So hairy skin receptors cross a bulbs, that is for pain, nociceptive, and then roughness, and then roughness for slow vibration, and tactile disc corresponding to Merkel disc, which is in non-hairy. This is hairy. Mean arterial pressure can be calculated with diastolic blood pressure SBP plus 2 by 3 dBP. Laminar flow, then Reynolds number less than 2000. 2000 to 3000 is transitional. More than 3000 it becomes turbulent. Physiological dead space is more than anatomical space because it is the sum of anatomical dead space and alveolar dead space. Postrenal segment of IVC is developing from supracardinal vein. Labyrinthine artery is from AICA. Gray and white ramus, white as I, so it is inflow of sympathetic, so gray will be outflow of sympathetic. Typical intercostal nerve, so Horner syndrome affecting is in the inflow, white ramus. Typical intercostal nerve 3 to 6. Cranial nerve 12 is supplying the occipital myotome, the palatal muscles, except the palatoglossus, that is exception. It is supplying the tongue muscles 12th, except palatoglossus, which is pharyngovagal plexus. Primordial germ cell is originating from epiblast in second week of development. Blood supply of posterior limb of internal capsule, remember mnemonic cap. Charcot's artery, that is from middle cerebral charm. And A for anterior choroidal, that is from mnemonic acineto, AC, anterior choroidal I, that is from internal carotid artery and cap. So C Charcot's, A for anterior choroidal and posterior cerebral, that is supplying the posterior limb of internal capsule. Esophageal carcinoma, the main treatment you have to give is radiotherapy, very radio sensitive. In higher grade you have to give chemotherapy also, it's not surgery. Lever ratio is 1.3:1, overlay underlay with respect to annulus, either lateral or medial. Overlay lateral, underlay medial. Optic atrophy types, you can have primary optic atrophy, the problem with nerve like multiple sclerosis. Then secondary optic atrophy, papillitis, papilledema. Consecutive optic atrophy means associated with retina problem like retinitis pigmentosa. Most common complication of anterior uveitis, inflammation, so glaucoma, whereas recurrent anterior uveitis leads to complicated cataract. Visual field extent is S. What is the equation? ISNT, that is 50, 60, 70, 80. Intermediate uveitis is actually pars planitis. Argyll-Robertson pupil is seen in neurosyphilis. Accommodation reflex present, light reflex absent, plus anisocoria, that is the history. Histological change in MI, okay, that is remember the mnemonic WCC, up to 4 hours, wavy, 4 to 12, coagulation necrosis, 12 to 24, contraction, band necrosis. Next is first step of evaluation in polycythemia. You have to look for erythropoietin value, whether it is primary or secondary, rule out. If the EPO levels are low, primary. If it is high, secondary. Sirtuins are deacetylase. Orods are lysosomes. Fixed low, that is actually saying how much consumption, that is equal to cardiac output into the difference of arterial and venous oxygen concentration. Nernst equation, that is actually 61 log concentration in by concentration out. Filtered load GFR into plasma concentration. Taste receptor ligand gated is which one? It is salt and sour. Sweet is T1R2. T1R1, T1R2. So these are T1, sweet and umami. Bitter is T2R receptor, whereas T1R and T1R2 and 4 even numbers, sweet. Umami, that is odd number, T1R3. T1R1 and 3, sweet 2 and 4. Action potential generated in motor neuron initial segment M is there, so motor neuron. Sensory, it is first node of Ranvier. Neuropeptide Y is causing vasoconstriction. Descending pathway from, so always somebody asking you why, so you are getting constricted. Descending pathway from that is from periaqueductal gray, you have raphe nucleus that is inhibiting the transmission in nociceptive pathway. Effect of efferent arterial constriction, then initially hydrostatic pressure increase, so GFR increase. Later oncotic colloidal osmotic pressure increase, so GFR decrease. Narcolepsy is in actually REM, sleep. Erythropoietin production from two places, liver and kidney, then mainly from liver. Seminal vesicle, the component of its secretion, remember two important things, fructose, prostaglandin. Interstitial fluid volume calculation, how to calculate interstitial fluid, that is ECF minus plasma, whereas intracellular fluid is total body water minus extracellular fluid. Permutate is actually for both the temporary and permanent hardness, it is sodium aluminum silicate. Health survey and development, D, so B. Board committee and survey and planning, P, so M. Modelier committee. Formulating food standard for international market is Codex Alimentarius. Chloride effect on spores, it is not sporicidal. Period of communicability of chickenpox, -2 + 5. Rubella -7 + 7. Measles -4 + 5. Mumps -4 + 7. So that is with respect to rash. So rubella, it is symmetrical, -7 + 7. Lysis drug of choice is DEC, diethyl carbamazine. So that is same like a filaria, that is also DEC. Class 1A antiarrhythmic is blocking both sodium and potassium channel. Influenza management inhalation is zanamivir. Oral is oseltamivir, O for O. IV is paramivir, parenteral. Bone fracture in throttling, that is manual strangulation, hyoid. ligature strangulation, thyroid. In hanging, the judicial hanging, it is vertebra, hangman's fracture. Otherwise, in hanging, it is problem in carotid artery, that is intimal tear, Amosac sign. Garlic powder for phosphorus. First-hand knowledge is common witness. Radiotracer uptake increased in only bone-forming lesions, not in decreased in lytic lesions like multiple myeloma. Stochastic effect, the examples like cancer and chromosomal like mutation. Whereas other thing related to hair or skin, the lens, cataract, all those things comes in deterministic effect. Image of two things you can get confused. Schistosomiasis, the X-ray calcified like a fetal skull, whereas same picture you may be confused. So read question. If it is a contrast given, it can be thimble bladder. Likewise, another important thing is Staghorn calculus, and same in TB, moth-eaten calyces. You have to look whether it is contrast given or not. Then tram track appearance in optic nerve seen in optic nerve meningioma. So stay tuned. We will again do so many questions and crack this exam. Okay.